Florida has been record-breaking numbers on a day-to-day basis. We actually had the highest number of cases, almost 15,300 cases in just a single day. These are obviously pretty alarming for the healthcare community as we're starting to see pressures on our systems. This probably goes to go with the idea that people are probably getting a little bit more tired of staying indoors. We've been doing this for almost 6 months. January 21st was the first time we had a reported case of COVID-19 in the US in Washington. We started taking precautions early on, staying at home, wearing masks, but I think a lot of people are starting to get a lot more tired. Also, with states opening up a little bit earlier than some other states, states like Florida where the bars and restaurants were open, people started to go out a little bit more, and I think their guard came down. As a result, a lot of people started to contract COVID-19 and share it amongst their family members and friends. As a result, the healthcare community is starting to get a little bit more of that burden now. A lot of the contingency plans that we had made in the early stages of the virus back in February and March are now being put into play today. During April and May, we weren't really having to use these plans as the numbers were staying at bay. But as July and June started to kick in, these plans are starting to kick in a little bit stronger today. There's a lot more definitely that we can do as a healthcare community and as a population outside of the healthcare community, to really help keep this at bay. But, we're not done with this virus as of yet. I really hope that people start to take their own actions into their own hands, start wearing that mask, keeping a little social distance, and only going out when they really need to. This is just a short moment in our time, in the grand scheme of things. And I really hope that people really take a little bit more self accountability to ensuring that they're keeping themselves safe, but also their parents, their family members, and even the more vulnerable populations.